Hello, and welcome to the Almonds and Cardiometabolic Health webinar. My name is Swati Kalgaonkar, and I am Associate Director for Nutrition Research Program at the Almond Board of California. I have a PhD in nutritional science and an extensive nutrition clinical research experience. My primary focus is oversight of ABC contracted nutrition research, public policy analysis and synthesis, and information dissemination in support of the almond industry's global strategies. Today, I would like to take you through the almond and cardiometabolic health journey. But before we dive into that, allow me to share some background information and statistics on cardiometabolic health. Let's start out with the question of the hour. What does cardiometabolic health refer to? It's a collective state of health, and it requires that we have a healthy heart, which means healthy cholesterol and lipid levels, healthy blood vessels that can constrict and dilate as required, healthy pancreas for good insulin production and normal blood glucose regulation, healthy liver for a healthy metabolism, and of course, a healthy body composition. So a follow-up question becomes, what does cardiometabolic disease refer to? Now, if we went by Glassbergen humor, it's an age-related condition of experiencing highs that are no fun whatsoever. High blood pressure, high cholesterol, high blood sugar, high anxiety, and you get the picture. But more scientifically speaking, cardiometabolic disease describes a spectrum of conditions, beginning with overweight, obesity, insulin resistance, then progressing to prediabetes, metabolic syndrome, and if unchecked, culminating in more severe and chronic conditions like cardiovascular disease and type 2 diabetes. We all know that a body mass index of higher than 24.9 is unhealthy. The range of 25 to 29.9 represents overweight BMI. That of 30 to 34.9 represents an obese BMI, while that over 35 represents extremely or morbidly obese BMI. Well, here's a 2021 World Health Organization global map showing the latest overweight and obesity statistics worldwide. The map key indicates how the population-wide percentage of overweight and obesity increases with an increase in the color intensity. Now, looking at the map, the dismal state of health worldwide becomes extremely apparent. With the exception of a few countries, most are in the high percentage range, with about 70% of the US population overweight or obese, and UK not very far behind, with about 67% of its population in the same boat. So then it should come as no surprise that when looking at global burden of disease by cause, that cardiovascular disease is responsible for the largest share, and in fact, exceeds disease burden from cancers and other non-communicable diseases combined. So what factors contribute to one's cardiometabolic state? Well, one of the factors that none of us have much control over is our genetic makeup. An individual is considered at risk for a medical condition if there is a family history of that condition. For example, high cholesterol levels or high blood sugar levels. Yet another impactful factor is anxiety. which comes from living in a high-stress environment. Now, depending on one's situation, it may be possible to control and dial down one's exposure to anxiety. The one factor we can certainly control almost entirely is our diet and our lifestyle. Going back to the lighter side of things, we can probably blame gravity for not lowering our cholesterol levels when it certainly has the pull power on other parts of our body. But on a serious note, we know that we are responsible for our own health at the end of the day. So it's important, especially as we age, that in addition to a good diet and lifestyle, we regularly monitor our blood pressure, maintain a healthy weight, watch our cholesterol levels, and control our blood sugar levels. But going back to diet, we know that it plays a very important role in helping to maintain cardiometabolic health. Dietary Guidelines for Americans 2020-2025 edition provides invaluable recommendations on ways to ensure a good diet. And apart from recommending a healthy dietary pattern at every life stage, the guidelines also recommend nutrient-dense foods and beverages. And as you can see from the highlighted text on this slide, nuts are an integral part of that recommendation. The guidelines also recommend that those 2 years and older should limit their intake of saturated fat and replace it instead with the intake of unsaturated fats. And nuts are a great source of good unsaturated fatty acids. Another recommendation by the Dietary Guidelines Committee is the intake of a Mediterranean-style dietary pattern, among other healthy dietary patterns. So here's an example of what Mediterranean diet looks like. It's a diet rich in sources of good unsaturated fatty acids. And once again, as you can see, nuts are an essential part of this diet. Robust nutrition research plays a pivotal role in helping to shape such recommendations and guidelines across the globe. And many studies now clearly demonstrate the role of nuts in achieving a healthy cardiometabolic state. For the longest time, nuts have had to fight off the stigma of being high-fat, calorie-dense foods that might result in weight gain. Several nut studies have since been conducted and have successfully dispelled that notion. Most recently, a systematic review and meta-analysis analyzed all of these nut feeding trials with and without dietary substitution instruction to assess the impact of nut intake on body weight and composition. So results from 55 studies that were included and analyzed indicated that with dietary substitution instructions, there was no change in body weight. And in fact, there was a significant decrease in body fat percentage. Additionally, with or without substitution instructions, nut-containing diets did not result in an increase in either body weight, body mass index, or waist circumference. So these results not only help clarify, but also solidify the role of nuts in weight management. The PREDIMED study is a great example of a study defining the role of nuts in cardiometabolic health. This study randomized a total of 7,447 participants to one of 3 intervention groups. The subjects were allocated to either receiving extra virgin olive oil, a minimum of 50 milliliters per day for participants, or to mixed nuts, namely almonds, walnuts, and hazelnuts, at 30 grams per day, which amounts to 1 ounce or 1 serving of nuts per day. The third arm of the study was a low-fat control. After a length of almost 5 years, 288 major cardiovascular disease events occurred in these participants. And as you can see in the figure, crude hazard ratios for both the extra virgin olive oil, let's call it the EVOO group, indicated by the green line here, and the nuts group, indicated by the orange line, were significantly better compared to the control group, which is indicated by the black line. Now, the hazard ratio is a comparison between the probability of events in a treatment group compared to the probability of events in a control group. And it's used to see if subjects receiving a treatment progress faster or slower than those not receiving the treatment. So another way to explain the data here is that those receiving nuts and the extra virgin olive oil are demonstrating a low probability of lifestyle diseases. Additionally, after a 1-year follow-up, participants in the nuts group showed a significant 13.7% reduction in prevalence of metabolic syndrome, which amounted to twice the improvement compared to other intervention groups in the study. Once again, providing strong evidence in support of the role of nuts in cardiometabolic health. Within the world of nuts, it is really, really remarkable to see how well the almonds have been investigated for their cardiometabolic health benefits. One of the most well-studied areas of almond nutrition research is that of heart health. But let's first take a look at what in almonds makes them a food so special. As we can see on this slide, the nutrient composition of almonds is key to their role in cardiometabolic health. Almonds are a rich source of alpha tocopherol, or vitamin E, an antioxidant that is the most beneficial form of vitamin E in humans. Almonds also provide 20% daily value of magnesium, a nutrient which is well known for its multiple health benefits, including its role in helping to regulate blood sugar levels, especially during gestation. In fact, a randomized, double-blind, placebo-controlled study published in 2018 demonstrated that co-administration of vitamin E and magnesium in women diagnosed with gestational diabetes resulted in significant lowering of plasma glucose and significant reduction in total cholesterol and serum triglycerides. Overall, the study demonstrated major improvement in glycemic control and lipid profiles in expecting women. In addition to these hero nutrients, almonds also provide good fatty acids, fiber, and 6 grams of plant protein per serving, nutrients that have all been shown to play a vital role in heart health. Since we're talking about heart health, here's some Maxine humor related to cholesterol. To help bring her cholesterol levels under check, Maxine's doctor asked her to watch her cholesterol. So now she stares at her French fries for a few seconds before she eats them. Obviously, we all know that it isn't that simple. Humor aside, one thing we know can certainly help is incorporating healthy foods like almonds in your diet. Here's some clinical evidence for the same. The first almond study investigating its heart health benefits was conducted way back in 1992. Now, because it was the first study of its kind, without a previous reference dose, the study investigated a rather large dose of 3 ounces of almonds a day and found that despite their high fat content, almonds helped lower cholesterol levels. These results generated excitement and interest in additional studies. And David Jenkins and his group of researchers at University of Toronto decided to investigate if almonds demonstrated a dose response in cholesterol lowering. So adults with high cholesterol were recruited for the study and administered either a full dose, which is an average of 74 grams of almonds, or a half a dose, which is an average of 37 grams of almonds per day over a period of 3 months. The study results found that almonds lowered low-density lipoprotein cholesterol, which is the bad fraction of cholesterol, an average of 4.4% with the half dose, but a whopping 9.4% with the full dose. So there does appear to be a dose effect of almonds on lowering bad cholesterol. A subsequent study investigated how different forms of almonds might impact total and bad cholesterol levels. This study used whole natural, roasted, and butter forms of almonds. All 3 forms were found to significantly reduce bad cholesterol levels. In fact, almond butter was found to even slightly increase good cholesterol, which is high-density lipoprotein cholesterol levels. And we will visit why that might have been the case a little bit later in the PowerPoint. Now, over the course of time, multiple studies in the area of heart health generated a strong body of evidence in favor of almonds. This evidence, taken together with evidence from other nut studies, was used for a health claim application to FDA. In 2003, FDA approved the following qualified health claim on the heart-healthy benefits of nuts. It reads, "Scientific evidence suggests, but does not prove, that eating 1.5 ounces per day of most nuts, such as almonds, as part of a diet low in saturated fat and cholesterol may reduce the risk of heart disease." The quest for almond heart health benefits expanded. This study was conducted by Joan Sabaté's group and investigated if almonds would help improve vitamin E levels in addition to improving cholesterol levels. The study investigated a low almond diet at 10% energy intake from almonds and a high almond diet at 20% energy intake from almonds against a control diet. A significant dose response effect was observed between percent energy in the diet from almonds and plasma ratio of alpha tocopherol, or vitamin E, to total cholesterol. Then, in a more recent study, almonds were found to not only lower cholesterol levels, but also improve vitamin E levels in Korean adults as well. So you can see that there is consistency in results that are being obtained from these studies. Taking things a step further, this study by Berryman et al. Demonstrated that in addition to decreasing bad cholesterol and total cholesterol levels, almonds also reduce belly fat, waist circumference, and total abdominal mass. The study not only looked at traditional lipid and lipoprotein measures, but also investigated the levels of high-density lipoprotein and its subparticles, the one lipid fraction that we actually try to increase the levels of in our bodies because of the role it plays in preventing deposition of bad cholesterol in our arteries. Consistent with results from other studies, this study not only found a significant decrease in total and bad cholesterol levels, but also demonstrated a significant reduction in belly fat, which, as stated earlier, if unchecked, poses a great risk to cardiometabolic health. Additionally, the study demonstrated a significant reduction in waist circumference and in total abdominal mass, all signs of improvement in cardiometabolic health. The same study also looked deeper into the impact of almonds on the subparticles of HDLC and found that almonds not only helped increase levels of good cholesterol, but also helped increase levels of alpha 1 HDL, which is a good subparticle within HDLC. So after having gathered over 2 decades of evidence in the area of almonds and heart health, a systematic review and meta-analysis was funded to analyze results from several of these robust clinical studies for a collective impact of almonds on heart health. Now, systematic reviews and meta-analysis provide what is considered the highest level of evidence and allow researchers to draw meaningful conclusions from a comprehensive body of research. The results of this systematic review and meta-analysis established that consumption of 1.5 ounces of almonds, which is similar to or same as 42 grams of almonds per day, not only help lower total and bad cholesterol levels alongside triglycerides, but also help maintain good cholesterol levels, a benefit that is quite rare to most heart-healthy foods. So the key takeaway from this study is that almonds are a great food to incorporate in your diet if you're looking to help lower your total and bad cholesterol levels. Cholesterol levels are one aspect of cardiovascular health. Blood pressure, as we know, is another. While we may not be able to control all the different factors that impact our blood pressure, we certainly have control of a few. This study by Rick Mattis and his study group demonstrated that almond consumption during a 12-week energy restriction reduced truncal fat and systolic blood pressure, a greater reduction in total fat, diastolic blood pressure, and a greater tendency for reduction in visceral adipose tissue was observed in the almond group compared to the nut-free diet group. It is important to note that in addition to demonstrating a reduction in the upper body fat, a result that's consistent with other studies, this study also showed a significant reduction in both systolic and diastolic blood pressure. The health of a blood vessel is important for healthy blood pressure. So it was imperative to investigate if almonds played a beneficial role in that area as well. A study conducted at King's College London by Sarah Berry and Wendy Hall investigated the role of almonds in improving the health of blood vessels, an assessment called flow-mediated dilation, or FMD. Again, as I said, a marker of blood vessel health. The study found that almond consumption significantly improved FMD in addition to the consistently observed reductions in cholesterol levels. The next key research area of blood glucose management is equally important as it's closely related to heart health as well. For those of us Glasbergen humor fans who are in denial of our own lifestyle and dietary habits, blaming the dramatic increase in diabetes over the past 20 years on global warming might give us a good comic relief. But we're all too well aware of the reality of this situation and once again know that it's up to us to keep these numbers down. Once again, clinical evidence from almond studies show that almonds can help. Southeast Asian phenotype is the most challenging in terms of type 2 diabetes. This study conducted in Asian Indians demonstrated heart health benefits of almonds in type 2 diabetic patients. Results from studies across different populations and different health status have shown extremely consistent results. So 16 studies to date in a variety of subject populations and with different blood glucose-related outcomes show that almonds not only help reduce insulin resistance, but also help improve the levels of hemoglobin A1C, a clinical marker of blood glucose regulation. India has the second highest number of diabetes patients aged 20 to 79 years. So several new studies are focused on the glucoregulatory health benefits of almonds in the highly challenging Southeast Asian population. The studies are currently underway and results are awaited. Weight management is an essential part of heart health. Studies have been and are being conducted to look at several aspects of how almonds might play a key role in weight management. Before getting into how almonds help with weight management, it's important to understand what all factors impact this desirable outcome. And I think we can all agree that one of the most important factors influencing one's ability to manage their weight is their diet quality. A healthy diet, like the one depicted by the image on the left of this slide, is certainly desirable, while the diet on the right should typically be avoided or consumed sparingly. While it's not easy to tease out if one good decision leads to another, it is possible to show correlations and associations by collecting data on dietary habits and health. Just like National Health and Nutrition Education Survey, or NHANES, collects dietary and health data in the US, the National Diet and Nutrition Survey, or NDNS, conducts a survey of diet quality and health parameters in the UK. In a recently published study, analysis of NDNS data demonstrated that whole almond consumption is associated with better diet quality and cardiovascular disease risk factors in the UK adult population. The study reported a whole almond consumption of 7.6% in the population and showed that consumers had higher diet quality scores relative to non-consumers of almonds. They also demonstrated lower intakes of trans fatty acids, total carbs, sugar, and sodium in consumers, alongside higher intakes of protein, good fats, fiber, folate, vitamins, and minerals, and of course, a lower body mass index and waist circumference. Several studies have analyzed NHANES data as well for association between almond consumption and nutrient intake and health behaviors. This research, for instance, suggests that consumption of almonds is associated with greater positive nutrient intakes. Adults who reported eating almonds also consumed more protein, fiber, good and saturated fatty acids, vitamins, and minerals, and less added sugar, saturated fat, and sodium. Results very consistent with those found when looking at NDNS data. Almond eaters were also found to be less likely to smoke, more likely to be physically active, and have a lower body mass index and waist circumference versus non-almond eaters. Now, although not a causal relationship, the data from this study suggests that eating almonds may contribute to a healthier diet that can also help Americans fill nutrient gaps. Snacking is a way of life for most Americans. The majority of the US population consumes 3 meals a day, plus at least one snack. So this research by Ream and Drionowski is extremely useful and shows that swapping out common empty calorie snacks for nuts like almonds and or adding almonds in quantities ranging from 1 to 2 ounces to a healthy eating pattern can have significant benefits, including improved satiety, healthy cholesterol, and improved nutrient intake and diet quality. The study also reviewed NHANES data to investigate the impact of replacing typical snacks, commonly consumed snacks with almonds, and found that snacks contributed nearly 1/4 or 25% of daily calories. 60% of those snack calories came from empty calorie foods. Topping the list were sweet desserts high in refined carbohydrates, and examples of those are listed here on this slide. Replacing these empty calorie snacks with almonds showed a decrease in empty calories, saturated fat, sodium, carbohydrates, and added sugar, and an increase in protein, magnesium, dietary fiber, and healthy fats. Healthy eating index scores also improved by over 15%. So when it comes to diet quality, there is ample evidence in favor of almonds influencing diet quality for the better. So that's definitely a reason to believe that almonds would also have weight management potential. Along with diet quality, the amount of caloric intake, and not just the quality of it, also influences weight management. Typically, nuts have been regarded as a high-calorie food. But recent research has shed light on the fact that the amount of calories in a food do not necessarily dictate the amount of calories consumed and utilized by the body. Evidence indicates that the weight-managing properties of almonds might be a result of the almond structure, where the lipid molecules seen in red or yellow dye in this picture are encapsulated within the almond cell membrane, illustrated using the blue dye. A microscopic study of that structure reveals that with our usual food chewing practices, a lot of the lipid droplets in almonds are kept from being released and hence from being absorbed by our body. This led researchers to believe that the actual energy intake from almonds might be lower than that determined by Atwater factor. So researchers at USDA, under the leadership of David Baer, investigated metabolizable energy values of several forms of almonds. This is energy that is actually absorbed and utilized by the body, as opposed to the energy that's merely calculated in a given food. The research results found that metabolizable energy value of several almond forms was significantly lower than that determined by Atwater factor. Now, the same research was also conducted for some other tree nuts, but unlike other tree nuts, the research was repeated in case of almonds. And the same results were obtained by the research group at the University of Toronto. This is a very recent publication in the Journal of Mayo Clinic, and as the highlighted statement indicates, almond-related energy bioaccessibility, again, energy that is accessible to the body, demonstrated an average reduction of 21.2%, very similar to the results obtained by the USDA study. This difference in the amount of caloric uptake by the body highlights another reason why almonds would be great as part of a weight management diet. Satiety, or feeling of fullness, and how long one can hold on to that feeling after consuming a food is also a contributing factor to weight management. Consuming empty calories causes more frequent hunger spikes, and we all witness that. Whereas consuming nutrient-dense foods like almonds has been shown to be quite satiating. A randomized clinical study looking at the effects of eating either an ounce or an ounce and a half of almonds compared to no snack on ratings of appetite and fullness and overall calorie intake at lunch and dinner was conducted. The study participants felt the least hungry and ate significantly fewer calories at lunch and dinner when consuming the ounce and a half of almond snack. Despite eating approximately 170 to 250 calories from almonds, there were no differences in total daily calorie intake, indicating that the participants organically, naturally compensated for the additional calories consumed earlier in the day. A study by Rick Mattis also investigated the effects of almonds on postprandial glycemia, which is blood sugar levels soon after a meal. The study also looked at appetite, short-term body weight, and fasting blood parameters when consumed with meals or alone as a snack. This 4-week randomized study in subjects with increased risk for type 2 diabetes demonstrated lowered serum glucose responses postprandially in the almond-consuming group. Almonds consumed as snacks also reduced hunger and desire to eat. And without specific guidance, daily energy intake was also reduced. Additionally, dietary monounsaturated fatty acids and alpha tocopherol intakes, which we again know to be vitamin E, were found to be significantly higher in all almond groups. So the study demonstrated that almonds provide post-ingestive metabolic and appetitive benefits without increasing the risk for weight gain. And finally, a recent study published out of University of Leeds shows that almonds regulate the reward center of the brain by suppressing the mesolimbic pathway, or the reward system, that otherwise favors the intake of unhealthy foods. So given all these compelling reasons to believe that almonds can be effective towards weight management, 2 weight management studies are currently underway, one at the University of South Australia and the other at the University of Otago, to study the impact of almonds not only on weight loss, but their ability to help keep the lost weight off. So, in terms of key takeaways from today's presentation, I hope I have demonstrated to you the role that almonds play in helping to maintain a healthy blood pressure, in contributing to the various factors that in turn contribute to maintaining a healthy weight, in helping to improve your cholesterol levels, and in helping to regulate your blood sugar levels. Taking into account the totality of evidence presented here today, we can see that almonds play an important role in improving and helping to maintain cardiometabolic health. Finally, I'd like to wrap up by highlighting resources for our dietitians on almonds.com. If you are a regular visitor to our website, you already know that we just launched a new website, and we're thrilled to have a beautiful new platform that allows you to easily navigate to areas of interest, including dietitian tools and one-pagers that can also be used as great educational tools. In addition to the website, you can also follow us on Facebook, Twitter, and Pinterest. And with that, I'd like to thank you for attending today's webinar. And now we will open the floor for the Q&A session. Thank you. Well, thank you again for attending that webinar and welcome to the live Q&A session. I see a lot of really good questions beginning to get populated here in the box, but as I begin to answer them, I would like to encourage you to please keep putting your questions in there. So with that, I'll go ahead and get started with the very first question that I see there. It says, you mentioned that almonds are a source of unsaturated fatty acids. Do they contain monounsaturated fatty acids or polyunsaturated fatty acids? And how does that fatty acid composition play a role in heart health? I think that's a very pertinent question. As I indicated during the talk, almonds actually contain both monounsaturated fatty acids and polyunsaturated fatty acids. In fact, almonds are a great source of unsaturated fatty acids, but they do dominate in terms of MUFAs, which is the monounsaturated fatty acids. And the way monounsaturated fatty acids and polyunsaturated fatty acids, which are called MUFAs and PUFAs for short, the way they play a role in heart health is by making sure that we have healthy cholesterol levels and healthy triglyceride levels. If we're eating unhealthy fats, then we have higher amounts of total cholesterol. And as most of our dietitian friends would agree, we would also show higher amounts of bad cholesterol levels, which is the LDL cholesterol level. With replacement of saturated fatty acids with unsaturated healthy fats, what research has shown is that you tend to have lower total cholesterol levels and significantly and definitely better lower LDL levels or bad cholesterol levels. Now, in the case of almonds, you also tend to see maintenance of good cholesterol levels, which is the high density lipoprotein cholesterol levels. And if you are familiar, and I'm sure you are, with the Dietary Guidelines 2020-2025, one of the main recommendations that came from the guidelines is to actually replace the intake of saturated fatty acids with good unsaturated fatty acids. And that's precisely where almonds would play a role. So here's another question. It says, why do you think the almond butter showed, sorry, I'm just going to scroll down to be able to read the entire question here. Why do you think the almond butter showed improvement in the HDL cholesterol as well as the LDL cholesterol compared to the whole almonds and roasted almonds only showing improvement in the LDL cholesterol? So I think that's a great question. You might remember that I mentioned the metabolizable energy value study during the presentation. So what that study actually looked at, the study that was conducted by USDA, it actually looked at energy coming from different forms of almonds. And as it showed, the metabolizable energy was most bioavailable from the ground almonds or the almond butter form. So needless to say, energy is really coming through the macronutrients that we see that are part of almonds, and definitely the fatty acid profile plays a very big role in that. So with the regular chewing habits that we have, the regular mastication, as we call it, when we chew normal, regular, raw, natural almonds, we're not able to grind it down to a point where it becomes a paste and releases all the lipid molecules in there. Those lipid molecules are of the essence when it comes to improving cholesterol levels. So although with raw and roasted almonds, you do see enough release of good fatty acids where they're able to have an impact on total and bad cholesterol levels, because almond butter is mechanically ground and is able to release all of its good fatty acids or most of its good fatty acids, you do see a reduction or rather an improvement in the good cholesterol levels as well. So for that reason, with the intake of almond butter, you are actually able to see an improvement in HDL cholesterol levels. And that's actually a really significant achievement for a whole food. So I hope that answers that question. Here's another question. It asks, should almonds be soaked and skin removed to be eaten as a snack? And is it about 23 almonds a day? So I understand that soaking and removing the skin and eating almonds on an empty stomach is a practice that has traditionally been practiced in India for a very long time. And anecdotally speaking, there are a multitude of benefits that are believed to come from consuming almonds that way. From my understanding to date, there are not very many clinical studies that have looked at the benefit of soaking and consuming almonds with the peel removed. There is one study that came out of a research group in Pakistan, that did show that consumption of soaked almonds after soaking them overnight and then peeling them first thing in the morning and having them on an empty stomach actually does provide significant cardiovascular benefits. And from what I can remember, the study did show a significant reduction in total and bad cholesterol and might have even showed an improvement in HDL cholesterol levels. So definitely there might be a benefit to it. But as I said, not very many clinical studies have been done in this area. And this is perhaps one area for us to look at. As far as whether or not it's about 23 almonds a day, I would just take you back to the FDA qualified heart health claim, which recommends having 1.5 ounces of almonds, which is about a handful and a half a day for the heart health benefits that I outlined in my presentation. But I would also like to add to that that is really the lowest recommendation, because if you're looking at adjusting it according to your BMI, people might have higher BMIs, and 1.5 ounces may not suffice. In fact, what the studies that we have funded have shown is that in case of higher BMIs, it is okay to consume anywhere from 15 to 20% of your daily calories, which is basically the amount of calories we spend eating snacks, commonly consumed snacks, which might actually be high in empty calories. So replacing those with almonds and consuming that energy intake in the form of whole almonds would provide similar health benefits for those with higher BMIs. So if 1.5 ounces seems not enough, then that's the other recommendation to follow. I hope that question was answered. So moving on to some of the other ones that I see here. Now, in terms of the dietary guidelines and recommendations provided, you may have also seen that dietary guidelines is recommending the intake of Mediterranean dietary style pattern. So in case nuts is something that you are unable to incorporate in your diet, there are other sources of mono and polyunsaturated fatty acids that can be incorporated, and those are provided as part of this Mediterranean style dietary pattern by the dietary guidelines. Some of those foods include things like olive oil and avocados. Depending on whether you're a flexitarian or a vegetarian, you can also look at including sources of protein, like fish, for instance, that would also provide you with both the protein and the mono and polyunsaturated fatty acids. I hope that question has been answered. There is a question here about, sorry, the questions keep moving. I'm going to scroll down again. Are most of the benefits for diabetics you've presented mostly for whole almonds, or similar evidence for almond butter or almond milk? So that's a great question. Actually, when we have conducted, or rather funded studies, and those studies have been conducted by the experts in the field, what we have generally provided to the subject population is either whole natural almonds or roasted almonds. So not very many studies have been done with almond butter. And we certainly have not looked at almond milk as a way of that was not used as an intervention at all in any of the studies. So most of the studies that we have looked at are with whole almonds. And so they can be either in the raw natural form or the whole roasted form. So those are the two dominant form of almonds that have been studied. So I hope that answers that question for you. There is a question here that's requesting to talk a little bit more about FMD and what that process entails. So FMD is really looking at the dilation ability of your blood vessels. Your blood vessels will be able to dilate as and when required if you have healthy blood vessels. Now, environmental factors, genetic factors, things that are a part of one's habit, like smoking, for instance, can actually cause stiffening of your blood vessels, which basically means that when you're exercising, for instance, you require higher blood circulation, that your blood vessels may not be elastic enough to expand to allow for the required amount of blood flow. And so in cases like that, you really do need to improve the health of your blood vessels. And so one measure that's used to understand whether or not a certain food or a certain practice that you're beginning to follow, whether or not that's having a healthy impact and it's helping to improve the health of your blood vessels, is looking at flow mediated dilation, or FMD as it's called. And so essentially what it is just really looking at the ability of your blood vessels to expand after they have been constricted for a while. And so in the test itself, which is a very fascinating test, in the test itself, what's done is the subject is asked to lie down flat for some time, making sure they're rested for some time, and the results are not getting impacted by the fact that they're either sitting up or moving around. And so after they've been in a resting position for some time, the sensor that actually senses the blood flow is put on both arms. Now, in the control arm, where the sensor is just basically looking at regular blood flow, nothing is done to the control arm. But in the arm where you want to sense or test whether or not the elasticity would work, you actually allow constriction of that arm using a blood pressure cuff. So when you go to a doctor's office, we have all experienced the constriction that comes when the doctor or the attendant actually inflates the blood pressure cuff. And so a similar constriction is caused, and that causes, you can actually see the reading. It's in real time. It appears on the screen. You can see the reading. It shows how your blood vessel is now constricted. And so after the constriction has been sustained for some time, the blood pressure cuff or the pressure in the cuff is released and blood is allowed to flow back into your arm. And when that happens, the expectation is to see the blood flow become more than normal. So the amplitude, the volume of blood needs to be more than what the regular blood flow in your artery should be to allow for more blood to go through, because we've been constricting it for some time and your tissues are in need of greater oxygen, greater glucose. And when that happens, when you actually do see a significant increase in that amplitude, you know that your blood vessels are working well. When that doesn't happen is when it's a cause for concern, and that's how you know whether or not your blood vessels are healthy. So I hope that explains that particular measurement, and that was a very fascinating question. Thank you for asking. Okay, and I'm scrolling down again to see if there are other questions here. So here's a question. It's asking, are almonds pasteurized? Can you explain the process for pasteurizing almonds? What temperature, how much time period? And are any of the valuable nutrients in nuts affected by pasteurization? So that's a very good question to ask. I can provide you with the answer to the first one because my expertise is in the area of nutrition research. We actually have an expert at the Almond Board who who provides expertise in the area of food safety. And in fact, he would be the right person to answer the question about, what temperature is used and for how long and things like that. But the answer to the first question is yes, almonds are pasteurized. Also, as part of nutrition research, what we do is to make sure that we're continually measuring or analyzing almond nutrient composition. So we always send almond samples to a third-party, accredited, certified laboratory to continue to analyze almond composition on different kinds of almond forms, on different varieties of almonds, and yes, even before and after pasteurization. And what we've seen is that the nutrient composition of almonds before and after is highly comparable. So there's not any significant loss of nutrients as a result of pasteurization. And in fact, there is a high improvement in the safety and intake of any food that should go through pasteurization. So pasteurization is a necessary technique. So I hope that answers that question. And we'll be sure to forward the other part of your question to our food safety expert, and we should be able to get back to you with an answer offline. Okay. So another question I have here is, regarding whether or not almonds have been shown to play a role in improving liver health. So for that particular question, I can tell you we have funded studies, or rather a study in the past, or a couple of studies, where we have looked at liver fat as one of the outcomes. However, for liver fat to actually show a positive improvement, you really need to start with a subject population that has high liver fat. Now, in the studies that we looked at, or the studies that we funded, the investigators were looking at a population that did not have a high liver fat to begin with. And so in a study where you don't necessarily have an issue with your health, you're not going to see an improvement in it because you're already at your optimal level. And so as a result of that, in these studies, we didn't necessarily see an outcome, even though we were looking at it as one of the outcomes. But the guidance we got is the reason why we are not seeing a difference is because we really need to start with a different sort of a population that's actually high in liver fat. So unfortunately, that's all the time we have right now. Thank you really very much for attending. And for the nutritional professionals listening in right now, I wanted to let you know that we will have an upcoming webinar about weight management on June 23rd with Dr. Rick Mattis. And for those of you familiar with his name, you know he is the past president of the American Society for Nutrition and a very renowned professor at Purdue. After this break, join us for a session on almond co-products with Josette Lewis, Chief Scientific Officer at the Almond Board. Our final filmed in the orchard session entitled A Whole Orchard Approach to Waste Management and Soil Health, and our closing panel discussion with all our 4 growers. Thank you again for joining. Bye-bye.